prolotherapy.
Oh, really?
Well, lady on a knee, an elbow. There was also another hip, another labral issue.
Mm-hmm.
And I feel like, obviously, I know I don't have the silver tongue. But I feel, and especially when pertaining to the Prolo techniques, I'm not really as knowledgeable as you are. If you could just want to explain this a little bit.
We're going to do prolotherapy injection technique on Randal's hip. No steroids. It's a therapy developed by Doctors Himmel and Hackett back in the 1930s. It's been around for a very, very long time. It's a non-surgical approach to orthopedic problems. Not every orthopedic problem is a surgical problem. As a matter of fact, the more I get into this, the more I believe that very few of them actually are surgical problems unless there's actual break of the bone or something that's just irreparable. What we do is we go in and we inject the joint space and the ligaments that hold the bones together that make the joint with a substance that induces the release of growth factors, and these growth factors actually induce healing. And that's why that you do this technique about every 4 to 6 weeks. You repeat it because you have to give time for healing and growth in between each injection. But it's a very safe thing. It uses only local anesthetic and some other natural substances that will induce the healing process. And it's much, much safer than a general anesthetic. And the surgery, much less infection, much less surgical complications, essentially zero general anesthetic complications, and only the reactions that you get with local anesthesia if you're allergic. So it's very, very safe and been around for a long, long time and very effective. And Randal's progress to this point shows that its effectiveness is undeniable.
I agree.
The hip joint.
Right when I got close, I could tell what it was with this thing.
The patient lies on the pain-free side with the lower leg flexed and the upper leg straight and resting on a pillow so that it lies horizontally.
We can have a leg pillow.
I have it right here. I just didn't do it yet. Okay. I've already done all that. Leave this one flexed, and this one is going to be kind of straight like that over the foot, okay? Like most everything else, location, location, location. Oh, there it is.
Samantha didn't want to come this time?
What?
Samantha didn't want to come this time?
Well, she's, I guess, had to stay for the Mary Kay thing or whatever.
Oh, okay, okay.
Hungry. Doing injections makes me hungry. What does that mean?
That means you're a weirdo.
Yeah, well, we already knew that.
Alright, so you want me to get the needle going in or your face?
You just use your creative license and film what you want to film there, okay?
Ordinarily, I would take some stuff and freeze the skin. But since Randal is a man, I just went ahead and did it without
I
freezing the
realized
skin.
we didn't have the freezing stuff this time.
Did it make a difference? Could you tell the difference?
No, I really feel it's about the same.
Yeah. That's what I thought, too.
By the same, I mean not fun.
That looks enjoyable.
I don't feel a thing.
Nice good swelling point back there.
To do the insta bubble.
Yes. Joyous.
Good times, good times.
See this? I may want to come over a little bit more.
You want it to
Toward
come
this
up
way.
more? Let's make it another one.
One for the capsule, one for the joint. One for the little boy who lived down the lane.
Not bad, not bad. That looks good.
This is a part of the prolotherapy that not everybody does. It's oxygenation therapy. We're going to inject some ozone into the capsule, and seems to really be beneficial for healing. This is the mad scientist portion. Okay. Here we go, ladies and gentlemen. Reagan's really getting into this. Right on the capsule.
Pretty thick needle.
It's actually a very thin needle. It's a 22 gauge, but it's long. Has to be long to get down to the joint. And as Randy just noted, we're not able to numb up the nerves down there very well.
Does not feel good.
Okay, here we go. In the joint space. 2 cc's. I went up and down the area of the bone where the ligament attached, and then I went off into the joint space. And we're going to put a little ozone into the...
Can you hear that?
Mm-hmm.
I can feel that. Oh, gosh.
There it went. We just blew up the joint space that time for sure. That's how long the needle is. That long. Here to here.
Because it's hard to see. Okay, yeah, I got it.
Okay. We're done.
CC's, baby. You're turning Spartan fit. That's what it's all about.